this video, we'll discuss about acute suppurative osteomyelitis. So, the definition is that it is the osteomyelitis of jaw, which is a serious sequelae of periapical infection that often spreads or that often results in diffuse spread of infection throughout medullary spaces with subsequent necrosis of variable amount of bone. Now, it is basically a sequelae that it is a successor of a periapical infection which spreads to the medullary spaces and causes the necrosis of subsequent parts of variable amounts of bone. Now, coming on to the age, it occurs in more than 30 years of age. It is more common in males than female. Now, coming on to the location, it is more prevalent in mandible than maxilla. What happens is the buccal and lingual cortical plates, they are thicker. Then there is, as I told before, accumulation of pus in intermedullary cavity. Now there is an increase in the pressure. Now the pus cannot escape into the surrounding tissue. Now coming on to the clinical features. In clinical features, we see that there are the symptoms of the classic symptoms of inflammation. First of all, in mandible, what we will see is that there is a diffuse and widespread area of infection, whereas in maxilla it is well localized, okay, to the area of initial lesion, to the area of initial lesion. Now coming on to the features, the presentation first of all is high remittent fever, deep intense pain, paresthesia of lower lip because inferior alveolar nerve is being involved. Then the cause is identifiable, minimal swelling, no teeth mobility, no fistula. Now the lab findings include there is an increase ESR, then there is positive radionuclide scabs. Also, there is leukocytosis because it is inflammation. Now, coming on to the radiographic features, what happens in first 2 weeks, there is very little signs. So there are very little radiographic evidences. So there are diffuse lytic changes. The individual trabeculae, they appear fuzzy and indistinct. They appear radiolucent. They appear as moth-eaten appearance or with moth-eaten margin appearance. Now the sequestrae, there are multiple radio-opaque foci. They have a diminishing foci. They have diminishing radio density. So the another one involucrum. Now in involucrum, what we will see is we will see gray shadow on the outer surface of cortical plate. Cloacae, these are the dark shadows traversing the bony opacity. Then there are multiple radiolucent abscesses which are called as Brody's micro abscesses. Now coming on to the histological features, histopathological features. Now first of all, since it is an inflammation, so we will get to see inflammatory exudate in the medullary cavity. There will be occasional lymphocytes, PMNLs, plasma cells. Then the osteoblasts that border the bony trabeculae are destroyed. Osteoblast bordering the bony are destroyed. Then the trabeculae may lose their viability. Slow resorption. Now coming on to the diagram for the acute osteomyelitis. Now coming on to the differential diagnosis. For it, there can be a primary intraalveolar carcinoma or a metastatic tumor in bone with secondary infection. Then there can be a primary mesenchymal malignant neoplasm. Then there can be an intraosseous salivary gland neoplasm, primary lymphoma of bone. Now coming on to the treatment, as any, first of all incision and drainage, then antibiotic therapy, then the removal of sequestrum is very important because otherwise the healing will not occur, and the elimination of primary source or the cause.